What's going on, guys? It's Pauly G with Pauly G Fitness, and let's go over SMFR, Self-Myofascial Release, on the glute fold area. Okay, so from here, almost like the glute medius, if you were to grab your butt cheek and lift it up, right where you feel that tight band, if you were to dig into that, that's gonna be your glute fold, and that's what we're gonna focus on. So it's on the upper part of the hamstring, so the back of the thigh, upper part of the hamstring, but the lower part of the glute and where they connect, okay? So this portion specifically, because we sit all day, right? So we're like this and we sit all day. To use our hamstring, we pull back and flex, right? So if we sit majority of our day, this is constantly getting tighter and tighter and tighter, okay? Driving, using the restroom, eating food, relaxing, working at a desk. This is constantly being flexed, which means it's constantly being shortened, all right? And the glute fold release for the SMFR, that's gonna be to make that portion extend further so we can easily be able to stack our joints with our pelvis. Okay, so for this position specifically, if my hamstrings are tight and it's pulling, I'm actually going to do this type of motion. Okay, my hips are going to be back. That's an anterior pelvic tilt. So what I want to do for me is have a posterior pelvic tilt, be able to extend through the hip, and then now my joints are stacked. So if you think about it, ears over shoulders, shoulders over hips, hips over knees, knees over ankles. That's how we joint stack. That's that neutral spine position that I talked about in the introduction for SMFR. So now, to show you how it's done, okay? You're gonna sit on top of the ball, one leg at a time, right on that glute fold where I talked about like that butt cheek thing. We're gonna sit here. You're gonna load your toe. So you're gonna load your toe, so my back toe is actually loaded. I'm on my toes, or lay your foot on your laces, whichever is most comfortable for you. And we're gonna explore that glute fold. So whether it's more on the outside portion of the leg, so lateral outside, or more on the inside portion of the leg, medial, or dead center in the belly, which is the most common, right in the middle. And again, we want to find that pain point, explore it. Everybody is different, so just explore it once you find it. What I'm going to have you do is sit yourself up as high and as tall as possible to get that joint stacking, ears, shoulders, hips, right? And then the next thing I'm going to do, because most likely everybody's back is going to be rounded like this, I want you to think of poking your butt out like Donald Duck. That's going to actually lengthen that hamstring in this position as we dig into that dry tissue and start to open it up and get some more fluid in there to rehydrate. So again, we're holding this 30 to 60 seconds. That tension is being brought on. It doesn't want to feel pain, so our body is resisting. That's why we shoot for 2 to 5 minutes each one. In through your nose, out through your mouth. Breathing, slowly extending, getting longer and longer. Think of a string at the top of your head pulling you nice and straight, and then we're trying to tilt the hips back. Think of Donald Duck butt, okay? And just hold there. You might feel a tingling sensation like I do myself right now, going down the back of my hamstring, from the back of my calf all the way to my foot, but just know you are on the money, all right? I'll see you guys on the next one.